Hey everyone, it's Dr. Jess. Welcome and welcome back to my channel. In today's video, we're going to talk about drug interactions. We'll cover cytochrome P450 enzymes. We'll specifically go over the effect of enzyme inducers. Let's talk a bit about cytochrome P450 enzymes. So cytochrome P450 enzymes are primarily located in the liver. Majority of medications are metabolized by cytochrome P450 enzymes. Now, there are several types of cytochrome P450 enzymes. So, for example, we have 3A4, 2C9, 2C19, 2D6, 1A2, etc. Now, we need to talk about substrate to understand cytochrome P450 enzymes. So, a substrate is a substance on which an enzyme acts. So, when a drug is a substrate of an enzyme, that means that enzyme metabolizes the drug. The drug is metabolized by that enzyme. So, for example, warfarin is a substrate of the cytochrome P2C9 enzyme. So that means that 2C9 metabolizes warfarin and converts it into an inactive metabolite. Now, let's talk about cytochrome P450 enzyme inducers. So, what is an enzyme inducer? Enzyme inducers, they increase the production or the activity of that enzyme. So therefore, they increase the degree of the drug metabolism. And what will that do? That lower blood levels of the substrate. So remember, when a drug is a substrate of an enzyme, the drug is metabolized by that enzyme. Okay? Now imagine you have a drug that is a substrate of an enzyme. So that means the drug is metabolized by that enzyme. And then now imagine that you have an inducer of that same enzyme. What will the inducer do? What it will do is that it will increase the production or the activity of that enzyme. So if it increases the production of that enzyme, what will that do? Then that will increase the metabolism of the substrate. Is that making sense? It will increase the metabolism of the substrate. So if you are increasing the metabolism of the substrate, what happens to the substrate? You have lower blood level of the substrate because the substrate is being metabolized more. Let's look at a practice problem to make sure we're understanding everything. So, warfarin is a substrate of the cytochrome P2C9 enzyme. Rifampin is a strong inducer of 2C9. A patient has been on a stable dose of warfarin and is now being studied on rifampin. What will happen to the concentration of warfarin? What will happen to the INR? So, this is the same idea. So remember, warfarin is a substrate of 2C9. Okay, so the patient is stable on warfarin. Now you're adding a 2C9 inducer. What is the interaction here? What will happen? What will be the effect of the inducer on the substrate? The substrate is the warfarin. What will be the effect of adding an inducer while the patient is already taking a substrate? So you have warfarin, which is a substrate of 2C9. You're adding an inducer of 2C9. What will happen? I'll give you all 10 seconds to write your answer in the comments below. Do you think the concentration of warfarin will increase, will decrease, will stay the same, or none of the above? Write your answer in the comments below. Okay, let's try to solve this together. So, rifampin is a strong inducer of 2C9 is now being added. So we talked about the effect of an enzyme inducer. So rifampin will increase the production of 2C9. What will that do? That will increase the metabolism of warfarin. So if we increase the metabolism of warfarin, what happens to the concentration of warfarin? The concentration of warfarin will decrease. If the concentration of warfarin decreases, what happens to the INR? The INR decreases. So that means you would have to increase the dose of warfarin to keep the INR therapeutic. So on a patient who's taking warfarin and you add rifampin, the dose of warfarin will need to be increased significantly. And this is the reason why, because of this interaction. Because warfarin is a substrate of 2C9, rifampin is an inducer, rifampin will drastically lower the levels of warfarin, which will cause the INR to be subtherapeutic, and you would have to increase the warfarin dose to keep the INR therapeutic. That's all I have for today. Please don't forget to like the video, subscribe to the channel, and turn on your notification bell so you don't miss out on any new uploaded videos. I'll see you in the next one. Bye.